Okay, hi everyone. Today I'm joined by Gareth Riddy, one of AMN's very top practitioners. We're going to be talking specifically about post-concussive syndrome, which is a diagnosis someone will receive from their medical doctor following an unfortunate concussive incident, or basically what is termed a mild traumatic brain injury. So, hey Gareth, how are you doing?
I'm excellent, thanks. How are you?
Yeah, I'm pretty good, thanks, mate. Um,
Sweet.
So, Gareth, you are a personal trainer. You've done an extensive amount of continuing education. You've always had an interest in the sort of neurological aspect of how the body works, and that's kind of from history of training lots of fighters and maybe being exposed to certain, concussion and things like that over the years. You are someone who's been through all of the AMN education. So you've done our coach certification, you've been through levels 1, 2, and 3 in the practitioner cert, and all the six mastermind modules. So in my mind, you're someone who really has the whole picture. And you're someone who I know contributes to the forums very regularly. You're helpful in terms of coaching other students who are getting into this game. And you're achieving a lot of great things. And I'm interested to talk to you about this thing you dealt with, this post-concussive syndrome. Now, post-concussion is something where it comes with a subset of symptoms, really, doesn't it? Tends to have it can have sleep disturbances. It can show digestive problems, behavioural changes. There can be pain. There can be balance issues, visual disturbances, all those kind of things. So, why don't you tell us a little bit about the presentation, the client that did come to you with some of these symptoms, and what those symptoms were?
So this was a guy that I knew anyway, kind of casually, I should say, and and basically he was out over Christmas enjoying the Christmas period in a jolly festive way, and he got into a festive altercation and got knocked unconscious basically, and he was having loads of issues. Went to doctors, and the doctor said, right, you've got post concussion syndrome. Basically, what you've got to do is go away and wait for it to go. So, avoid screens as much as you can and don't drive too much, which obviously wasn't ideal. So he contacted me because he knew I like brain stuff and said, can you help? And I was like, probably. And that was that. So he come in and I took a load of notes. I was asking him questions, all the normal stuff plus the form. And I found out that his digestion had gone. He'd gone completely irregular, constipated, that type of stuff. He'd lost his sex drive, which he was obviously gutted about. He'd lost strength in his abs. I did a few different muscle tests to see what things were firing. He couldn't do a sit up, and this was a guy who was pretty fit. He was into his boot camps. He was into running around, all that type of stuff, and all that stopped. And also, he became pretty much a bit of a social recluse. He kind of got more into duvet days than going out running around everywhere because he's like a sales guy. So it completely changed him massively.
Right.
His balance went, and what else? Oh yeah, and his tongue went all floppy in his mouth on one side. It was a little bit like a dog. It was highly entertaining.
And I'm sure you're only saying it like this because it's somebody you know, kind of in a friendly way, right? Well,
Exactly.
yeah,
Yeah,
yeah.
I wouldn't have ripped him if he wasn't a mate.
Yeah. Okay, so interesting first thing there. The doctors obviously said to avoid backlit screens, so avoiding blue light, and that's something that with concussion, a concussive injury can actually sensitize and alter how the brainstem responds to what are called non-native electromagnetic fields. So that is something just to be aware of if anyone has had um, a knock to the head and any kind of concussive effects, that blue light and non-native electromagnetic fields are going to be a little more problematic for those individuals. So just to mention that. So a lot of difficult and complicated symptoms there that the person presented to you with, and he'd been suffering with, and obviously a lot of change occurred to this guy's life. So it's not the classic thing that as a personal trainer with a background in neurology and a better understanding of how the body works is going to come across that often. But it's quite a common complaint these days. It's something that's had a lot of publicity recently. There's been movies about concussion, all sorts of things like that. So how equipped did you feel as an AMN practitioner to possibly help someone that walks in with these kind of subset of behavioural and digestive dysfunctions and things like that?
But I'd say I was very confident, mainly because obviously I'd done everything by then anyway. Everything you'd thrown out, I've been, dragging at you. And before that, one of my early clients, when I first started learning your stuff, had a history of traumatic brain injury anyway. So she was kind of like my practice dummy almost. I learned so much from her in the period of time that we worked, and I knew how effective it could be. And that was before I had all the top stuff. So I was like, well, I've got to be a help in some way. You know what I mean? There's no way that he's going to walk through the door and I'm not going to be able to affect him in a positive manner. It's just not going to happen. And I was right, thankfully.
Amazing. So I think it's important to point out here that we don't, AMA practitioners, we don't do any kind of diagnosis. Someone's arrived at your gym, at your clinic with a diagnosis already, a pre-existing diagnosis, a subset of symptoms. And also, crucially here, we're not doing anything where we're trying to actually drive and activate the system, are we? It's actually a very different approach, where we're kind of, we're altering what we call charge in the system, which then allows the brain and the nervous system to respond differently. And we kind of just point the individual in a certain direction and allow, I would say, the healing to occur. So it's not something where we have to be very careful with fatigue, and we're not driving the system, as I know other very highly skilled practitioners do. It's a very different approach. And how did you find the approach helped? What was the treatment plan? What was the duration? How long did you work with him, etc.?
So the treatment plan, I mean, really, it was just a case of see what happens. It was the jazz principle. Let's just do this and see where we go. Was pretty much it. The first session was where the vast majority of the changes happened, and a lot of it, I mean, he wasn't aware that the symptoms that had happened were a result of that anyway. Do you know what I mean? He just kind of didn't really think about it.
I think that's quite common as well, isn't it? People don't associate the trauma they've been through with what they're experiencing on a daily basis thereafter. Yeah, that's very true.
Yeah. So where was I? Yeah. So on the first session, the bulk of it was really kind of good. It kind of like balanced him out a little bit, well, quite a lot, and he was really positive. And then the next day, he was texting me saying, his sex drive was back, and in so many words, his digestion was back, and more ways mates talk to each other, all that kind of stuff. And then it was really just a case of I was seeing him a couple of times a week. It probably took a good 3 or 4 weeks to fully clear everything and get him back on track. Because you go back a little bit and then forward, then back and then forward, and then back and forward. But the bulk of it was done very early on. There's this case of just chipping away and making sure stuff solidifies more than anything.
Okay, amazing. So the end result with this friend of yours was basically that he had complete resolution to all of those symptoms, or he had partial resolution and still deals with something now, or?
No, it all went. His balance is back. His sex drive is more than back. So he tells me. All is pretty good. Yeah, now it's just a case of getting him back in shape.
So within a couple of sessions, you'd had the majority of the resolution occur, and then over this course of another couple of weeks, 2 or 3 weeks, let's say a month with you guys working together, he has complete resolution of all of those kind of life-changing, life-altering symptoms.
Yes.
Well, that's fantastic. That's an amazing result, and congratulations to you both on that. That's very encouraging to hear. And I'll say to students when I coach people privately and mentor people that when it comes to being a good practitioner, there's a few kind of traits that you require. You really need a good kind of analytical mind. You need to be able to sort of think critically and think outside of the box and utilize the tools that you have to be able to investigate someone's presentation of physiology to find where things are going wrong and what correlations there are. So you need to be creative with this process, and you also you need to be empathetic, but only to a certain degree, right? You need to have empathy that the person trusts you, and that you build that conscious relationship between the practitioner and the client. But you need to be able to stay slightly removed to be able to stay objective as about what's best for the person, what you're finding, and not get too involved in the kind of presentation that you're finding. And I know that this is again been a helpful trait of yours as a very, very excellent practitioner, because you're working also with something else quite complex at the moment, aren't you, which is a case of terminal cancer.
Yes. Yeah.
And this is probably the topic for another call altogether. But how is that going for you right now? Because this is something obviously very new to both of us with regards to AMN.
Yeah, it seems to be going really well. I would say, Um, so I was trying to think. So yeah, it's something. I mean, I said to her when I first met her that I just wanted to kind of practice, see if I can help get her out of pain, that type of stuff. But because I knew that AMN can help the immune system and the body just function better generally, so I said, okay, well, let's just see what I can do. So in the end, I committed myself to her. I said, look, hey, you've got me now. I'm here. We'll just keep going. So I'm in contact with her pretty much every day, as and when I can. And the pain has come down considerably. Sometimes it goes up again, but then when I get to it again, we can get it down again. Emotionally, she's in a much, much better place as well, much more positive, which is ultimately what it's all about. If you can get somebody in a better emotional state, then they actually have a chance in life.
Yeah.
Not saying I'm going to cure or anything, but we'll have a bloody good go.
Absolutely. Well, I know it's something that in your history you've been through also, so a unique perspective for you to be working with that particular case, and I think we'll catch up about that at some point in the future. Hugely encouraging that we're able to use this system to help someone stay out of pain, even with something as debilitating and terrifying as that kind of diagnosis that we know she has. So. Congratulations on all of the good stuff that you've done so far. Love to both of you with what you're working on at the moment. I thank you for your time once again, and we shall speak to you soon, Gareth. Thanks very much, mate.